So strokes can happen to anyone at any age. According to the American Stroke Association, about 1 in 4 adults, 1 in 4 over the age of 25 will have a stroke in their lifetime. Even so, most adults don't know the warning signs of a stroke, and that stroke is largely treatable if you call 911 as soon as you recognize the symptoms. Joining me today is Dr. Ravi Pande. He is a neuro-interventionalist and director of the stroke program at HCA Florida Memorial Hospital. Good morning. Thank you for being here. I appreciate it. There is a fascinating treatment that you're actually holding in your hand. We're going to explain that to the viewer in just a moment. But first, you know, viewers hear heart attack, they hear stroke, they may not be familiar. Would you explain what a stroke is?
Stroke is a disruption of blood flow to the brain. So the oxygen and the nutrients don't get to the brain tissue, and hence the brain tissue dies and causes stroke symptoms.
And there can be different kinds of strokes, some much more severe than others.
So there are two different main types of stroke. One is an ischemic stroke, where there's a obstruction of the blood flow because there's a clot lodged within the blood vessel in the brain. And the other one is a hemorrhagic stroke, where there's a leak or rupture of the blood vessel, and the blood leaks into the brain and causes brain damage.
And so as a result, are there different than warning signs associated with each of those, or are they pretty much the same?
The hemorrhagic stroke will come on very suddenly, can cause sudden severe headaches or loss of consciousness. But the ischemic stroke has an acronym we use to recognize the symptoms of stroke. It's called BFAST. And B stands for balance issues or gait imbalance. E is for eyes if you're having vision loss, sudden vision loss or double vision. F is for face if you're having facial droop or facial asymmetry if you ask them to smile. A is for arm weakness or arm numbness. Easy way to recognize this would be to ask the patient to hold their arms up. And if they're having weakness or drift in their extremity, that's a symptom of stroke. S is for speech. If you're having difficulty expressing yourselves, or you're having gibberish speech or nonsensical speech. And T is just a way to remember that time is of the essence, and it's time to call 911 if you're having any of these symptoms.
I want to point that out because I've actually talked with family members, and my father actually had a stroke about 7 or 8 months ago. And would you please explain why it's so important? Because there's this anxiety, well, maybe it's okay. Let me just wait an hour. I really don't want to have to go to, you know, call an ambulance and go to emergency room. Would you explain the difference between 10, 30 minutes, an hour, maybe even longer in terms of the outcome?
Yes.
If someone's had a stroke?
Time is of the essence here, because the sooner you can bring the person to the hospital, the sooner we can give them this treatment. So there's two different types of treatments for stroke in the acute phase. And first one is IV medicine that we can give through their peripheral IV in the arm. It's called TNK or TPA. It's a strong clot-busting medicine. It's an FDA-approved medicine that can be given within the first 4.5 hours of the onset of stroke symptoms. If the patient gets it as soon as they come to the hospital, there's a chance that the occlusion in the blood vessel may open up and improve their symptoms.
Right, and after 4.5 hours, you can't give that treatment.
Yes, that medicine is only approved for the first 4.5 hours.
Okay, so keep that in mind for any of our viewers at home. Now, this video that we're showing at home is something that you're actually, you also have in your hand here. Could you explain what we're seeing first on the video, and then we'll explain what you're demonstrating?
So there is a treatment for certain types of stroke patients that can be provided even up to 24 hours. It's called stroke thrombectomy or mechanical thrombectomy. And what we are seeing here is that stent retriever deployed into the clot, and then we are just removing the clot physically from that obstructed blood vessel in the brain.
And it's really incredible with technology that you're able to do this. Now, you have brought this with you, and could you explain then? Because now, how is this procedure carried out? You said it goes through the groin sometimes or elsewhere.
Yeah. So this is done minimally invasive procedure through a wrist, a small incision in the wrist or through the groin, and we advance series of catheters into the brain and into that obstructed blood vessel in the brain. And you can see this is a stent retriever. If you want to, if you want to hold this, I can show you. So it goes into that obstructed blood vessel like this.
So you put it in like this, yeah.
Yeah, and then we deploy this stent retriever into the clot, and then just remove the clot physically
And then you pull it back
bone.
out.
Yeah,
And that's how you're able. So this then comes back in. And
Yes.
wow, that is incredible. Has this been available for a long time?
This has been available for almost a decade now, but really gained steam about 2015, 2016, when there were multiple trials that showed that this treatment is effective even up to 24 hours.
So fantastic success rate.
Yes, very, very high success
Doctor,
rate.
thank you. Such an important reminder for our viewers in particular, too. Don't wait. If something is amiss with your loved ones, call. Make sure you do it, because the difference between waiting just a short amount of time and longer can really be the difference of life or death. We'll be right back.